Hi there, thanks for tuning in. This time I'm back with a video about medical care in Dominican Republic. So let's get started. When it comes to healthcare, the Dominican Republic is far ahead of most Caribbean countries. Not only is the quality of medical care superior, but wait times for treatments are shorter and the cost is also much lower than what you pay in most countries. The quality of healthcare in the Dominican Republic, however, differs in different parts of the country. With the large number of expats who made the North Coast their home for decades, the medical services available in Puerto Plata, Sosua and Cabarete are as good as you'll get back in your home country. The healthcare system in the DR is represented both through public and private sectors. Public hospitals, which are state-owned, exist in every large town in the country. Their healthcare facilities are generally free and accessible for everyone. Yet medical services such as stitches, x-rays and medication will have an additional cost. Once admitted to any public hospital, the patients have to get their pillows, sheets, food, toilet paper, etc. to accommodate their needs. Usually patients' family members will have to look after them. In public hospitals, it's unlikely to find that the staff and medical professionals will communicate with you in English. Public hospitals may provide basic medications, but there are many meds that may not be available and you'll have to obtain them on your own. Folks here who do not want to visit public hospitals usually will go to private clinics. In places frequented by tourists and expats, there are private clinics with standard patient care, intensive care units and operating facilities. The staff and medical professionals in these hospitals can speak English, and many doctors have been trained at medical schools in North America. They also have world-class hospitals located in major cities such as Santiago, Santo Domingo and Puerto Plata. These hospitals carry out major operations including organ transplants and heart surgeries. The cost of seeing a doctor and various medical procedures to be performed is just a fraction of what you might pay in the United States as an example. And here in Puerto Plata there are a few private clinics/medical centers where you'll be taken good care of, such as Centro Médico Bonigal, Clínica Dr. José Gregorio Hernández, and Clínica Brugal. In Santiago, there's a well-known hospital called HOMS, or spelled H-O-M-S, Hospital Metropolitano de Santiago, where complex operations are undertaken and patients from all over the Caribbean region and the US come for health tourism. And HOMS is the largest hospital in the Dominican Republic and one of the most modern hospitals in Latin America and the Caribbean, which also performs robotic surgery. Another important point to note is that general practitioners or family doctors are rare over here. Thus, most patients visit an internist who can then refer them to a specialist. Over the last few years, the Dominican Republic have rolled out their 911 emergency system. These emergency services are available in Santo Domingo, east to Boca Chica, and west to San Cristobal. These services are also available in Puerto Plata and Santiago. The ambulance service is reachable at any more or less bigger townships, from where they dispatch vehicles to smaller areas, which sometimes takes from a few minutes to 20 minutes to get to the actual destination. In some private hospitals, they'll ask you for insurance or ability to pay up front before they admit you to the emergency room, even if you're bleeding or in septic shock. So it pays to have a friend there to help sort that out in case you're unconscious. Additionally, to the 911, the Dominican Republic has a number of private ambulance services that can be contacted in the event of an emergency. You can find a list of ambulances and emergency services available across the country in the description underneath this video. The list also includes air ambulances. The cost of calling an ambulance, however, is very high if you don't have an insurance policy. It can be around $1,000 and up depending on the driving distance. Folks, I'm here with Robert Neely, who runs a real estate brokerage down here, as well as Gringo Car Rental. So he's your guy for that. Now, Robert, have you ever been in an emergency kind of situation where you needed to go to the emergency ward?
I did. Happened in the middle of the night, and I was taken very good care of. Actually, never took a dime from me. It wasn't anything major, serious, but I went to an emergency ward in Montellano at their hospital, and the nurses and the doctors that needed to take care of something were very good.
That's a country hospital?
Yes, that's in the smaller town, roughly 20 minutes from Sosua.
Mm-hmm.
So it's a Dominican Haitian community.
Okay.
With a few expats living in the neighborhood as well.
So do you get the normal Dominican treatment?
I got
financially as well?
Financially, I never had to pay a dime. They were good. They just checked me out, and yeah, I mean, they treated me as if I was a Dominican in the sense of being in the country. I never got gringoed in price.
But did you have to show them insurance details?
Once they saw, I showed them my Mafre card, because that's who I have here, and never handed them any more money after that. Once I handed them because I have full insurance here now, and I've had since 2017.
Okay, so what can you recommend when it comes to folks coming down in terms of insurance cover?
Well, I use Mafre versus, I believe it's Humana, or is the other one. There's 3 of them, I believe. Mafre has been very good, no issues. The longer you have it, if you get full insurance, the more any deductibles for special procedures go down. And mine basically covers everything outside of air transport and one other thing. So I have the second best insurance that an expat could have. And for the cost of what I pay here versus in the United States and California, insane. It's cheap.
So where would you say the range is for most insurance?
Well, typically if you're paying monthly, it's around $40 to $50 a month for the really good insurance. Maybe the one above me might be $60. So if you're paying monthly, I pay it annually, so I just throw the money in my bank account, and then annually they send me a bill. But a lot of people like to pay monthly, so somewhere between $40 and $60 US a month.
Fantastic. There's also people who get group insurances down here. What can you recommend there?
Well, when I first started coming here, before I actually got my private insurance plan, we spoke to one of the insurance operators in Cabarete, and they all have what's called a group plan. So for $40 a month, as long as you send the payment before the first of the month, they'll have an insurance card for you. You'll have full coverage, emergency, hospital, ambulance, the whole bit. And that is usually cheaper than paying or trying to bring over your American insurance, and also less time consuming. So that's what I did in the beginning, and the $40 for the month, even if you're only here for 2 weeks, is really not a bad deal.
Doctors' home visits are not that common here. However, smaller private clinics will do home visits and even provide medical tests at your home for you. This service can get rather costly, so make sure you negotiate the price clearly up front. There are not many pediatricians in the region. However, you can still find some in Puerto Plata. The best way to find your doctor is by recommendation to the one that'll be a good health specialist for your child. Obstetric specialists are in good numbers here, and I would recommend that you go to Clínica Bornegal in Puerto Plata, where there's some knowledgeable doctors who will take good care of you. Although almost none of them speak good English, so you'll have to come with a friend who can help you with the translation if you get stuck, assuming you don't speak Spanish or that good Spanish. In this country, they tend to do a cesarean, even though it should be the last resort. So you have to talk to your doctor up front about your expectations. And don't let the tail wag the dog on this one, because it's your body, so it should be your choice. There are plenty of pharmacies all over the Dominican Republic, and some are located even in remote townships. Most of these pharmacies have long opening hours and are well stocked with medicines. Almost all medicines are available over the counter, including strong painkillers, antibiotics, steroids, anti-inflammatory drugs, and sleeping pills. The only drugs that require prescription are narcotics, such as morphine. Although some pharmacies will also provide this without a prescription, yet it is against the law. Most pharmacies will also prescribe medication simply upon you telling them or showing them the problem, which saves a trip to the doctor and money. Here you can buy as many pills as you need, and you don't have to buy the whole box, of course. And if you want a good pharmacy, I find price-wise and service-wise, Papa Terra Pharmacy in the same complex as the furniture store. You find a fully stocked pharmacy. They've usually got most things here, and they got a glass counter packed with different things. So give them a go. You can also pay your power bill and your phone bill here. Lately, more and more so-called health tourists, mainly from the United States, have been coming to the DR to get their dental services done. This medical field is considered to be very well adapted and comes with good value at lower cost than what you'd find in, say, US or Canada. Alright, so right across from Panaderia Dick and Friends Restaurant, you come into this mall here, and the second door on the left, you're going to see the Dental Center Cabarete. So let's just walk in there. Hola, ¿cómo estás, Ruth? Yeah, muy bien. And in here we have my dentist for many years. Hola, Dr. Christian.
Hey, Mr. T.
How are you doing? So they do everything from A to C when it comes to dental. He's even got another specialist that works with him.
Dr. Cruz, pathologist and periodontist, and she works in orthodontics.
And you do crowns, you do implants, you do the whole range. So what I like here, you get the same standard that you can expect overseas in Dominican Republic for half the price or less, maybe. You just have to inquire and get a quote from Dr. Christian. So come down and inquire, or inquire ahead of time. You can see the banner below this video clip. Thank you. Okay. Cheers. There's a wide variety of insurance plans that you can obtain here. For one person, the average cost of an insurance plan will be about $400 to $800 per year. Typically, plans will cover partial doctor's visits, hospital stays, in-hospital medicines, dental procedures, ambulance services, partial pharmacy bill, and transport costs back to your home country for additional care. To get an insurance for those who are over 65 is not easy, but it is possible. For example, there are group insurance plans to enroll folks up to the age of 75 and coverage to go to an age of 100, as long as you pay your premiums. Please inquire with your insurance agent about your options. Now let's talk to an insurance broker called Kenya. Yeah, folks, I'm here at Amber Insurance Brokers with Kenya, and I feel very privileged to be able to interview you. Thanks for jumping on camera. So I've got a few questions. I hope you'll bear with me that I use notes, because I want to make sure that you get the right information and I don't miss out on any vital info. So I have all the questions just written down. We'll rip into it now. The first one is, how long has Amber Insurance Brokers been around for in the Sosua Cabarete area?
We've been around for more than 20 years, and we're intermediaries, so we sell for different companies, not just one. So you have a variety of companies and prices that you can compare to.
Mm-hmm. And the type of insurances that you offer?
We sell car insurance, vehicle insurance, villa insurance, health insurance, any insurance that you may need.
Okay, fantastic. And which insurance companies do you typically help people get policies with?
We sell for Mafre, Banreserva, One Alliance, Humano, and Universal.
So what age do people have to be from and to in order to qualify for having insurance with most of these companies?
Well, each company has a different kind of age. So Mafre has the insurance that you can obtain it under 66, Universal is 65, and Humano is 64. It doesn't mean that you can't get insurance if you come when you're 68. You can, but you have to go into a collective plan. Mm-hmm. And it just means that you may have to pay for the year premium instead of comfortably paying monthly through a credit card.
Okay. Do you have to be at least 15 or 18 or 20 in order to obtain insurance?
You can get insurance as soon as you're 18 on your own if you're an adult. If you're a minor, then you have to be under your mum and dad to have insurance.
And in terms of prices, from the cheapest to the most expensive, roughly how much per year are people looking at in terms of getting a health insurance plan?
For the lowest coverage that you can get is very cheap. It's something like 2,000 pesos a month, which would be roughly in dollars, it would be $20 per month. But we have a package deal which is unlimited coverage with Mafre, and it's less than $1,000 per year, and it's unlimited coverage.
Now there's something we discussed yesterday called Casa de Conductor that's usually sold with like a car insurance, correct?
Yes.
Could you just explain what is Casa de Conductor to the viewers, please?
Casa de Conductor, we have it in Santiago and Santo Domingo. It's basically a hotel. It's a little halfway house that if in an event of a catastrophic incident on the road, this is totally for vehicle insurance, and there is a death, then that means that you have to go to jail while everything is sorted out through the insurance, whether you have insurance or not. And Casa de Conductor, you get picked up from the scene and taken to this place, to this special hotel in Santiago and Santo Domingo, and you stay there in a comfort zone until the lawyers in the insurances sort out anything that they need to.
Yeah, and I think most of you would appreciate that instead of sitting with 16 thugs who are up for something criminal,
yes.
You know, in a jail that's very undesirable to be in. So, Casa de Conductor.
Yes.
Yeah. Ask Kenya more about that. So, in terms of increasing a cover, let's say somebody's wanting to get covered for $500,000 more, or they just want to be sure that there's a big cover for different things. Is that something you can easily just say, okay, well, you can buy an extra $500,000 cover for X amount more per year?
Yes, for vehicle insurance, there's an umbrella policy, liability in excess, that you can pay for more insurance. And it's very cheaply. I have full insurance on my vehicle, my personal vehicle, and I have a liability in excess of 5 million, which is 1,700 pesos a year. So it's worth to get it because every part of your body has a price. So if you crash into somebody and you break their little arm, it is $500,000 to $1 million for a little finger. So every part of your body has a price, and you have to pay it when you damage other property or somebody.
Right. The other question is hospitals here. How good is the medical service in Dominican Republic, in your opinion, and medical centers, doctors and surgeons, etc.?
For example, I'm only dealing with private doctors right now because I only sell private insurance, and I cover the clinics, the private clinics. However, there are hospitals in Dominican Republic, and the hospitals are very well equipped. It's just that obviously the materials run out because we have a lot of people who don't have full insurance and private insurance, and they use the hospitals instead of clinics, so we have an imbalance. But hospitals are free in Dominican Republic, and the doctors that work in the clinics do have to give a certain amount of their time and weekdays to work in the hospitals for free. So even if you can't obtain health insurance, private health insurance, and you have pre-existing conditions, you can still go to a hospital and you can still live in this paradise island, even though you can't get private insurance.
So you also mentioned something to me about it's important to carry in your wallet or your handbag a card, an insurance card, even if it's the cheapest insurance or a travel insurance from overseas. What's the psychology behind the hospitals and medical centres if you're knocked unconscious, but they see that you have this card? What does that do in this country?
Well, it'll be really good if you're a tourist and you have a travel insurance that you put in Spanish, that you have insurance in your wallet, because in an event of an accident, they're going to go through your wallet and see if you have insurance or not. So if you don't have insurance, you're going to be taken to the nearest hospital. And if you do have insurance, you're going to be taken to a clinic. So that is the difference of having the card on you. And if you have health insurance here in Dominican Republic, it would be worth your while to carry it in your wallet as well.
So from the accident scene, where would the ambulance normally head with the person to a clinic initially?
It's the nearest clinic or hospital. So if you're here in Sosua, which where we live, you'll be taken to CMC and you will be stabilized if you don't have insurance and then taken to a hospital. But if you do have insurance, then you will be taken to CMC. If you don't want to stay in the center that you are, maybe you're in Santo Domingo and you want to be moved to Santiago, they stabilize you and they move you to the nearest clinic where you want to stay if you have insurance.
This is your lady. Contact Kenya on the details seen below in the screen, and you can ask more questions, get a quote, and I'm sure you'll be happy to help them out. Okay, we move on.
Thank you.
Let's hear what some expats have to say in regards to healthcare and insurances.
I've just met a friend here, Jerry Hall. I was asking about your view on the insurance down here. May I ask your age?
No, you may not.
I did, but I won't get the answer.
Just put down there, old guy.
Old guy.
I still have my insurance in Florida.
Right.
So whenever it's a major problem, I just go to Florida. I mean, if I'm going to have open heart surgery, I'm not going to have it here. I'm going to have it there. You know, I broke a clavicle here, and I used a private service, and it was so inexpensive and so cheap.
Yeah.
It's kind of useless because I'm here a month and there a month. It's kind of useless for me to pay both insurance companies.
Right. So basically, you're saying for lighter stuff down here, it's really cheap and it's good.
Cheap. It's good. They're really top shelf. You know, I don't have a problem going in there if I broke a finger or something like that.
Yeah.
But I mean, if I'm going to have a major operation, I need new hips, right? New
you do it back home.
I'm going to go to Florida because insurance covers everything.
Okay. How do you look at your healthcare down here as an expat? What do you do to take care or protect yourself from
buy
things?
insurance in Denmark, and you can buy one for a whole year, and then I can if I have a problem, I get sick, I contact the insurance company in Denmark, and then they find the hospital here, and they say they write where I can go, and I go there, and the insurance company and the hospital will take the money transaction together. I will not be involved in that.
So if there was an emergency and you are, say, knocked out, heavens forbid it ever happens, but if you're unconscious, what does your insurance do that's going to ensure that you get taken care of? Could you be taken to any hospital and that insurance should...
Yes, I can that, but normally they will, because I'm a white guy from Europe, they will drive me to international hospital.
Will that insurance you've got cover larger operations or just smaller stuff?
Bigger operation, they have to allow it, and I have to talk with a doctor in Denmark, and he has to say he has to be operated here, and then the company can allow it. The healthcare system in Denmark is much different than in the States, because in Denmark the hospital don't make profit of the hospital like in the United States.
Okay,
That's a big difference.
So you pay your high taxes, and then you got the ability to go to the hospital.
I pay $100 for the insurance for a whole year. Yeah, you can do many things yourself not to get sick. You try to behave good and take care of yourself. That's your own responsibility.
Yeah. because I have seen people come down here and drown themselves in the bottle, and other people have gotten into trouble because they're diabetics and they mix that with alcohol and they don't monitor their things properly. There's a few that have passed away from that. So yeah, just because you're in a country where the pace is a lot slower and the sun's shining doesn't mean you can't cause problems for yourself.
You cannot walk on the water.
Like you said, you have to take responsibility for your own actions.
I'm diabetic myself and I take responsibility. I try to eat healthy and make all my food myself in the kitchen, and I always be secure that I eat good food.
Very good.
And don't drink a lot of alcohol.
Now, Trevor, how do you look at the whole situation with healthcare? There's a lot of people, especially Americans, seem to ask me a lot about what's healthcare like in Dominican Republic.
Well, it's pretty good. I understand that healthcare facility here is good, but you've got to get on board at an early age, because there's a cut-off age at 70 years old. For me, I don't have any healthcare. I take care of myself. If you look at me now, I was born in 1943. I'm in my 81st year, and I'm part of the culture that grew up in the 1950s, and I relate to Mick Jagger, Paul McCartney, who are still performing at 80 years old. And the reason they're still performing at 80 years old is because they had the benefit of a wonderful diet.
Well, we see you on stage too down here.
Yeah.
Grabbing the microphone, which is great. Yeah. So you would put a lot of it down to diet.
Yeah, a lot of it's down to diet. I mean, you are what you eat. I can tell you now, when you'd be surprised, I've never ever been in a McDonald's. I don't know what a hamburger or a beef burger is. I've never touched them. Mm-hmm. Never.
Okay. No. Well, probably good advice from everything I've researched there. So, your general approach to healthcare in terms of protecting yourself against operations, accidents, do you have any insurance that covers?
I have that because the United Kingdom have NHS as a mutual agreement with the DR. If you paid into the system in the UK, which I did for all my life, 50 years, if I'm sick here, I can go to the HOMS. They'll perform the operation for me on behalf of the NHS in Santiago.
In Santiago.
Yeah, they will do the operation as part of the agreement, but I have to pay for any drugs.
Okay.
Yeah.
Well, that's pretty good.
Yeah.
And you can kind of insure yourself for pretty much anything.
Yeah.
Down here, it just depends on whether you're willing to take care of the smaller stuff. My style is more, if it's something smaller, okay, I'll be happy to pay out of pocket myself. So it's like user pays.
That's right.
And then if it's bigger stuff, then you can have the insurance for that.
Absolutely.
Yeah. Like if you go to Bornegal Hospital in Puerto Plata, which is probably one of my favorites if I have to go to a hospital.
One of my favorites, yeah.
I mean, you can go to the reception and they'll guide you to room 12B or 12C or whatever. Sure. There's a specialist for everything.
Absolutely.
They also treat you financially very much like you're a Dominican, because that's the majority of their patients coming in are Dominicans, so they don't really have any system set up to get the gringo.
That's right. I've been there on probably 3 or 4 occasions where I've needed specialist advice on something that I needed taken care of, and I agree with you, he gets shown to a certain room, a certain specialist, and he will diagnose the problem.
Yeah, fantastic. Okay, Trevor, super duper. We wish you a long, healthy life and all the very best.
Yeah,
and
I hope you still come out here and want to visit another video of me when I'm 100 years old.
Absolutely. Okay. I guarantee you I'll put you in it if I'm still around doing this. Okay, thank you so much.
You're welcome.
Cheers.
I live down here. I'm a Medicare. I cannot use that. But since I am a veteran, there's a veteran center here. Like I have a little bit back problem, I get therapy there and get massage once a week. Anything else that occurs, there is a 911 here in case there's an accident or something. The 911
ambulances
that are being called in it. So that's pretty good. And we have medical centers, privately. The public hospitals I wouldn't recommend. They were pretty crowded. But the medical centers here, there's 2 or 3 in Puerto Plata, which is about half an hour away from here. There's one here at Cabarete Center. So I don't think there's any big problem. So I take very good care of me. I usually don't get ill. If I get a little cold, I take more lemon juice and more fruits.
Let's just call
Pardon me?
us mature people, the mature people down here.
Well, I consider myself mature.
Yeah. Do they kind of more into, if there's a problem, I take care of it, more like taking care of yourself rather than relying on a system to do it for you?
An ounce of prevention is worth more than
A pound of cure. Yeah.
So it's pretty well established that you can take care of yourself pretty well here. There's a lot of tropical fruits, good meal. Everything is available here. Meat. We have a nice supermarket here, which is called Playero, that has all kinds of products that you might need. And there's health centers too, where they sell health products.
Mm-hmm. So, do you have any insurances in case something bigger happened?
Well, I don't. Many people do. There's health insurance available here. But as I said, I have Medicare, but an hour and a half away from Miami. If I have to fly down to Miami for any real emergency, which I haven't had, I have family living in Miami. I'll be 82 in July.
Okay. Going 50 in attitude there, so that's fantastic. Yeah.
I would say more 35.
Oh, fantastic. Well, you go to the gym and
yes, I go to the gym every other day.
Thank you so much for your words. All the very best down here, Renee.
Well, when I came and I had an insurance, health insurance from Universal. I came here in 2018. I paid them 2 times a year. In 2021, I paid them 54,000 pesos for 1 year. And now we are in 24. I have to pay them 40,000 for 6 months. And to be honest, I never used the insurance to all these years because I didn't need it. But in the beginning, I had some problem with my eye, and the insurance company, they were just incredible, helpful. They would pay for everything, no matter what.
Mm-hmm.
And
so you did use it in the beginning?
Yeah, I did. Yeah, during the first months.
Mm-hmm.
Yeah. And a few weeks ago, I had a little accident, but I didn't feel that good, so I had to go to the emergency at the GMC hospital. Told me my insurance didn't work, which I knew because I didn't know what I should do. Should I continue paying them? They treated me, they took an x-ray of my heart and my lungs. Everything was okay. And the doctor told me when I left to drink a green smoothie and go to the ocean, get some sun every day, which I have done.
Mm-hmm.
Yeah. So, and for the treatment, they gave me a CMC that was 11,000 pesos for everything. So I decided to stop having the insurance. The reason why I had it was, like you said, I'm from Europe. It's a very, very long way home for me if something happened.
Mm-hmm.
That's why I had the insurance for so long.
But you've decided not to now?
Yeah.
So you'd rather just take care of any situations yourself?
Yeah.
Yeah, I've gone into Bornegal before, the hospital in Puerto Plata, and this was where I just needed a room, a doctor, an x-ray. This was for a child. And they said, have a seat. A few moments later, they said, that'll be 6,500 pesos. And I said, okay, let's do it. And I really enjoyed the feeling that now I need it, and I was happy to pay, and it was very reasonable. I got treated just like any local Dominican would have been treated financially, because that's primarily who visits the hospital. So that was really good, I felt. So, everyone, I've got Andre with me here. Thanks for jumping on camera. Now, Andre, how do you look at the whole situation with healthcare? You're a young, 60 something, 70 something?
83.
83, there we go.
Pretty much outside the jurisdiction of healthcare. It's almost impossible to get any healthcare coverage after you pass 80, because you're way past death. You're supposed to be dead for 8 years, you know.
Yeah. Well,
So I'm
I
trying
think
to hold on.
sometimes they would like us to be. So how do you kind of look at it all now for you to stay healthy and feel protected, etc.?
Okay, I've always, when I was super healthy, and I've been super healthy for my life. I've studied Warren Buffett. He has billions of dollars, and he made billions from the healthcare business. He explains what happened. There's what you call a float. You make your payments, and the payment goes into investment and real estate, everything. You don't pay it. Maybe in 30 years they may have a hurricane, and you have to come up with $10 billion. And then you can borrow it because you've got all this massive real estate holding and other investment. You use on the paper that they have this float. This float is free money. Everybody pays every year for you. So inherently, healthcare, I mean, insurance is inherently very, very dicey. I never believed in it. Even when I was super healthy, I didn't need it. I needed insurance. So I paid cash for everything and never insured anything.
Right.
If they allowed it in a car, you can't drive a car without insurance. So I got the minimum policy to be able to drive legally on the highway. In case you have an accident, you're entitled to pay box $8,000 or something like that, which was the minimal.
So if you want to drive here right now,
I have a car. My girlfriend has a car, but I don't have one. I'm not sure.
Do you ever get behind the wheel?
I've done it very briefly for a few times, but my vision is gone downhill.
Right.
And the crazy drivers around me, you know, you drive a motorcycle, it's a lot of decking.
Yeah, I dodge metal all day.
With a car, especially at night.
Yeah.
It's I'd rather get a taxi, and I don't like motor scooter that much because they're dangerous too.
Yeah. Okay, so what's your advice to anybody coming down who's middle-aged or up, who wants to just feel secure health-wise? How should they approach the whole thing? I look at it, pay out of their own pocket, or should they insure themselves from head to toe?
I would say this: put aside a little fund for emergency medical. We never know what we're going to get tomorrow, or accident tomorrow. Things like that you would need in the U.S., but you probably 1/3 as much here because it costs the insurance. The medical costs about 1/3. You know, I just had a hip replacement, and I paid cash for it. It cost me less than $4,000. I had an American, a very reasonable guy in the U.S. who gave me an estimate of $14,000. So I paid cash, $35,000. If I was on Medicare, which I could be in because I'm way past the age, but I discarded Medicare. It gives me $100. It used to back then when it 68 when I took in Social Security. I decided to discard Medicare and get the money in cash. So I've been for the last 16 years, 17 years. I've been getting an additional $120. Back then it was $120. Now I'm sure it's at least $200. On top of my Social Security, because I don't take the Medicare, so it's a risk. But so far I'm ahead, and I believe that's the way I believe in insurance. I believe if you can pay, just hoard some money for a rainy day in case you have something happen, like my hip went bad, and I had to have a hip replacement.
And what hospital did you do it in?
I went to Puerto Plata, one of the
Donegal?
Donegal.
Yeah.
And
So
a great young surgeon. I mean,
very
I
sharp.
brought him all the paperwork, my health insurance, all my blood tests and everything. He looked through everything and he said, okay, when would you like to have that done? I said, how about tomorrow? He said, 11 o'clock.
Just like that.
I'm not used to that, you know. It took me 2 months just to get an estimate in the U.S. just to get the estimate of when they could do it,
Right.
which was another 2 months down the road. But here I am bringing all the stuff in less than 24 hours.
Yeah, I've even heard about Canadians tell me it can take up to 6 months just to get an appointment, etc. So yeah, here they don't mess around. If you got the money, you get the honey. Yeah.
And they always make fun of the Latin things, you know, mañana, you know.
Yeah.
You know, the thing about nothing's ever get done. But actually, things get done here because they don't have. They're missing two things that the U.S. has, which is a big problem. Attorneys. The U.S. has 5% of the world's population, but 80% of the world's attorneys. We have big insurance. Insurance and the attorneys come first. The doctor comes third, and the patients last on the totem pole. That's why American medicine is good, but extremely expensive.
Right.
Yeah.
Fantastic information, Andre. So this will no doubt be very helpful for people watching out there.
Yeah.
And stay healthy, stay strong, and keep having fun, because I know you live life to the fullest, and that's great to see.
Ready to go carouse around
To have a siesta. Yeah.
I'm done with the siesta. Now it's the fiesta.
No, it's the fiesta. Good stuff. All right. Thank you so much. You take care.
Okay.
All right.
Thanks for having me.
Tell me, what's your whole outlook on coming down here, living on this beautiful tropical island, and feeling okay medically? Or what's medical care for you?
Well, as you know, medical insurance, all that in the U.S. is crazy. I worked my job and I had excellent medical. So before I came here, I made sure I went to all my doctors, make sure that my health is good. After I retire here, that's it. I'm an old man. I'm old. I know I'm handsome and I look good, but I'm old.
So how old is that?
I'm over 70.
You're over 70.
So I already lived my life. I've been around the world, completely around the world 4 times. I've been everywhere. I've done everything I was going to do. I had an excellent life. I ain't care about medical insurance.
So what do you do to stay healthy?
Watch what I eat. When I came down here, I was like 235, 240. I dropped 50 pounds. My doctor was asking me to get down to 180 for the longest time in weight. So I'm down to 175, maybe 180, maybe.
Yeah.
So I'm right where the doctor wants me to be, and I'm beautiful. I watch what I eat. The most important thing is your intake. What you put in your body is going to determine how you live. So I'm very cautious of what I eat. I don't drink none of the water down here, and I just take it day by day. Number one, outside America, I'm living stress-free. So that worry and all of that is not going to be a problem for me.
Right.
So my biggest thing is just be careful on what you eat.
Yeah, fantastic. Well, it looks like you're getting customers here, so thank you so much for your comments again. And come down to the Brotherhood. He's got ice machine slashes here.
I got a manicure, pedicure.
Manicure, pedicure. He's got clothing store here.
Clothing store and a cigar lounge.
Cigar
so we
lounge.
want to come down and smoke your cigar.
Fantastic. Thanks, Victor.
Okay.
Yeah, everyone, I'm here at Crazy Smoothies and Fresh Homemade Ice Cream with the boss man, Mark. Thanks for jumping on camera.
Hi, guys.
Yeah, so Mark, your view on how to take care of yourself medically down here. You moved from South America, was it, to, originally America?
My family is from Ecuador, and I'm originally from the United States. I'm probably not the best person to give a lot of information about the medical care here, just because my family and I believe in doing things as natural as possible.
Well, you could be maybe the best person to get information from. That sounds good.
Well, yeah, we know a lot about herbs, and we know a lot about, you know, the types of food to eat, etc. And so, by the grace of God and maybe some of that knowledge, I've rarely been sick in my life, maybe a couple of times. I think that overall we're all pretty healthy. You know, little stuff comes up, but we usually figure out what to do with it from a natural standpoint. And so that's what I have to say. I really don't even know much about the doctor system, except that, you know, our niece had to go do a couple of minor things, and everybody seemed nice. Can say is that, you know, be careful in terms of find a doctor that you feel comfortable with, because there's all levels of knowledge even among the doctors. That's all I would say.
If you want to try his very natural products here as well, he's got a huge selection of ice creams and healthy smoothies, etc. And they whip it up for you in here. I'm just going to show where you're located, right across from Sosua in Bailey's and Banco Popular over here. So come on down, give them a visit, and thank you for your comments, Mark.
Well, thank you. And
stay healthy.
Stay healthy.
Now, one of the things you really have to watch out for down here is private hospitals that seriously lack in morals and ethics. In other words, some of them have achieved the status of the butcher clinics because they prioritize money over saving life. And I believe if anybody has an accident and they're either in septic shock or they've got blood squirting out of their body, they deserve, without any hesitation, to be dealt with and to be stabilized and to be saved. And then there may be 1 or 2 hours before the actual main operation is needed or more, but at least they save their lives without focusing on, but how are we going to get paid or which insurance company? Because a lot of the time these folks are knocked unconscious or they've lost too much blood and they can't fend or talk for themselves. And if there's nobody else around, quite often they're left to die off on an ambulance heading for another hospital, and they die on the way because the first hospital just didn't feel convinced they were going to get paid. So you'll soon learn which type of hospitals these are and choose the better ones. If you want to hire me for consultancy, I can teach you all this stuff and much, much more. info@educatedtraveler.info. Another thing about these private hospitals is they'll come up with excuses for you to book in a few more nights. It's all about selling you stuff but without telling you the final price, trying to get the gringo to operate on an open check. And you should never allow that. If they can't give you the prices up front and let you know exactly where you stand with everything, reject them. Get out of there and choose somewhere else. Another thing that can save you a lot of money and time and hassle is if you're in an accident and you have Dominicans come up and pressure you to pay to be the responsible one, even though you're not, you are maybe the victim in this situation, then having numbers and connections with Dominicans that will be on your side, that'll change everything for you. I also have contacts for police officers down here. So if you hire me for consultancy, that's the kind of information I'm willing to pass on during consultancy, how to handle the situations obviously, but also the contacts to such people. So you could say momento, and then you make a phone call, and then you get that person to come to the scene. Or if you call the police first, and that police officer comes to help you, that makes all the difference as well. That can save you money, time, and hassle. So if you want to hire me for consultancy, it's info@educatedtraveler.info.
Alright folks, I hope the information in this video will come in useful and help you make smarter choices when it comes to dealing with the medical care, dental, etc. down here. Thank you so much for watching and see you next time. Bye bye.